So if we look at the data, and if you look on the FDA website, you find this new pediatric labeling information database that contained all medicines that had new pediatric labeling thanks to the regulation. And you look at, as April 2020, it's 854 compounds which have been which have got new pediatric labeling. And as you can see, for 131, it has been both through BPCA and pre-A. So a company can really get the pre-A stick and the PPCA voluntary for a compound when developing in children. So let's finish with this part of the chapter with the reward, because you may be a little bit interesting to better understand how this reward works. In the US, it is called the paediatric exclusivity, which is an extension of the patent of the drug. In Europe, it is called extension of the supplementary protection certificate, which is pretty much the same concept. In both, this is 6-month extension. And it is important to have in mind that it concerns the marketing of a compound in all its indications, not only in children. So how does it work? It means that there is an additional period of premium revenue for the compound and the company, and a delayed competition with generics. If we look how it works, when a drug is approved, the drug is sold, there is revenue for the company, and for a period of time with exclusivity, 7 plus years. At the end, then the generics are proposed and enter the market. The revenue of the drug decrease, the revenue of the generics increase. With an additional 6 months, it means that the entry of the generics is delayed by 6 months, which means that the first drug is being continued to be sold as it was for the 7 years. And then it provides an additional revenue thanks to the 6 months extension. So we tried to figure out how much it was and how attractive it was. And the only information we found was in the economic assessment of the 10-year report of the European regulation, where 8 products were granted a reward for a total of 936 million euros.